Researchers at UBC are now using CT scans in an effort to find a better way to detect COVID-19. They've also partnered with Amazon Web Services to put the data they're finding online for anyone to access for free. Joining me now to explain all of this is Dr. William Parker, a radiology resident at UBC. Good to have you on the show this morning.
Thank you very much. It's a pleasure.
Walk us through how this project started in the first place.
Back in January, we identified that we don't fully understand how to properly assess COVID-19 on CT images. And so we went out to our colleagues around the world and we started to collect CT data from multiple different countries so we can identify some of the different nuances between countries and how the infection presents. We brought them to Vancouver General Hospital and we developed an artificial intelligence algorithm that helps us to better identify the percentage of lung involvement and then prognosticate patients to help identify which ones will do better, can go home and self-isolate, and which ones may need more support, like ventilation, ICU admission, and unfortunately, for some patients go on to death.
So what can be done with this information?
Well, this information is in a research phase right now. What we can do is, like I said, assess for percentage of lung involvement. And then from that perspective, we can start to think about, well, if this patient has much more of the lung involved, then they may not do as well. We also look for the subtle patterns that we see on CT for COVID-19, and these patterns can be more indicative of how patients will do in the long run. So it's really a diagnostic quandary. We're not focusing on the treatment necessarily, but we're helping doctors to better to correlate with treatment.
And certainly share that information. Thanks for sharing with us, Dr. William Parker, this morning. We appreciate it.
Thank you. Okay.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.